Welcome back. Do remember you can find all our top stories on channelstv.com and on youtube.com/channelsweb. You can also watch us on the go on your mobile device. All you need to do is log on to m.channelstv.com or download the Channels TV app for Android, iOS and Windows devices from their respective stores. The Channels TV and the Channels 24 apps will give you access to news and updates. You'll also have access to the Eyewitness feature, with which you can share pictures, videos, or news of happenings around you. Just install the app, then tap and swipe to reveal the menu, and don't forget to follow the instructions. The Edo State government is soliciting the support of the Economic and Financial Crimes Commission, the EFCC, in fighting the scourge of human trafficking as well as corruption in its domain. Governor Godwin Obaseki made the appeal to the head of the EFCC Benin Zonal Office, Mr. Malefia Yakubu, at the Government House in Benin City, the state capital.
For us, we are happy you have come in as a resource. Not to intimidate or scare people, no. It's to highlight the danger and the destructiveness of corruption in our lives as a people. That we never used to be like this as a country. When we had less, we did more. One area which may not be directly related to your remit, but we may have to bring some of the cases, when we find them to you, because it's corruption laden also, is the issue of traffickers, human traffickers, and their agents, and the law enforcement agency. Because somehow we just become a beehive for trafficking of persons. And the stigma we are facing as a state is not something we can continue to live with.
Edo State Governor Godwin Obaseki. Exclusive breastfeeding for nursing mothers around the globe is seen to be on the decline, as most working-class mothers find it very difficult to breastfeed their babies exclusively for 6 months. According to the 2014 National Nutrition and Health Survey, only 25% are exclusively breastfed from 0 to 6 months. As part of efforts to mark this year's World Breastfeeding Week, the Department of Pediatrics Aminu Kano Teaching Hospital, Kano State, has carried out an awareness program with a theme, Sustaining Breastfeeding Together.
According to UNICEF, more than 5 million newborns in Nigeria are deprived of essential nutrients and antibodies that protect them from disease and death, as they are not being exclusively breastfed. Approximately 7 million people are born in Nigeria every year, and according to the 2014 National Nutrition and Health Survey, only 25% are exclusively breastfed from 0 to 6 months of age.
The success rate of exclusive breastfeeding.
Sustaining breastfeeding together, which is this year's theme for World Breastfeeding Week, has been observed at the Aminu Kano Teaching Hospital, Kano State. It was an interactive session with lectures on the recommendation of exclusive breastfeeding as the best option for babies' development that will prevent infection and for the well-being of babies and mothers.
Globally now, about 1/3 of the under 5 death is caused by what? Non-exclusive breastfeeding. So if alone we can actually encourage breastfeeding, we will reduce this childhood mortality, or we will increase the success rate of exclusive breastfeeding by about 30%.
The mothers also confirmed that breastfeeding is very beneficial.
Why I intend to do exclusive breastfeeding for 6 months is because it helps my kids against so many diseases, which my kids don't used to be sick like other children.
Lots of Nigerian women are yet to embrace exclusive breastfeeding, and this underscores the need for increased sensitization campaigns and national policies to support improved infant health.
Kogi State Governor Yahya Bello has restated his commitment to providing quality healthcare services to the people. The governor has also performed the grand launch of the state's Save 1 Million Lives program and the biannual Maternal, Newborn and Childcare Week in Lokoja, the state capital. Governor Bello notes that through the state's Ministry of Health, government was able to equip 5 selected public hospitals across the 3 senatorial districts of the state.
State government officials, traditional rulers and members of the public gather at Kogi State Government House. It is the official launch of the Saving 1 Million Lives program a federal government initiative being domesticated in the state as a response to the poor health indices in the country, especially on maternal child health. The program is meant to run for 4 years and is funded by the World Bank to the tune of $500 million in 36 states and the FCT. The steering committee and the local government health committee will manage the state's shares of $1.5 to resolve issues around 6 thematic areas directly linked to the care of women and children.
We plan to engage community volunteer drivers for emergency transport of patients from selected health facilities to referral centers across the state. There will be also the recruitment of 944 community volunteers for continuous demand creation for saving 1 million life activities.
We have set key indicators, which my good friend, the Honorable Commissioner, enumerated, that will address the legacy issues of the main causes of maternal, newborn, and child mortalities in our country. If any state, for the first time, like Honorable Commissioner mentioned, we give $1.5 million free.
For Governor Yaya Bello, Kogi State will remain on the forefront of the health programs that will benefit its people and the country.
Let me tell you that not only they save 1 million lives, or issue of health, the health of a mother and child, we are equally concerned about the health of every other citizens in Kogi State here. And that is evident in the so many programs and projects that have been carried out in Kogi State here. Over 247 programs and projects, some at completion, some are ongoing as we speak in Kogi State.
As this initiative kickstarts in Kogi State, residents are hopeful that the health issues of women and children will be resolved and the mortality rate reduced significantly.
Well, from Kogi State, we move to Akwa Ibom State, where the Governor Udom Emmanuel says the importance of adequate and reliable data to the successful planning and implementation of government policies and programs cannot be swept under the carpet. The governor aired his view when he received the Director General, National Identity Management Commission at the Government House in Uyo. Governor Emmanuel notes that the absence of data has led to the failure of some otherwise laudable projects of government at all levels.
The focus now is to license both the government agencies and private sector to produce the card. And fortunately, apart from Lagos, where you have like 5 companies that can print this similar card, the only other place that we have a printer that can be able to do that is in Akwa Ibom by name Papi Printers.
I'm interested in having reliable data, and I'm also interested in knowing the data about our people so that we can also plan. I really want to assure you that we will partner with you. Thank you for your kind words in terms of power, but I'll please try and help us. You're already in 25 local government areas. Try and see how you can be in the whole 31. But I also want to say here, as the state government is also trying to mount a lot of campaign on how people could get a lot more awareness. You can imagine, if I'm to go with your information, 192 million, 18.5 registered. So what happens to the rest? So we are less than 10%. It's totally unacceptable in a country like Nigeria.
Governor Udom Emmanuel of Akwa Ibom State. We have more stories across Nigeria when we return. Stay with us.